Welcome to Have More Babies. Today, we're tackling a topic that, well, it feels like almost every parent bumps into at some point: ear infections in children.
Oh, absolutely. It's incredibly
And it
common.
can be pretty stressful, right? Seeing your little one in pain, maybe not sleeping well, it leads to a lot of worry.
Definitely. You're up at night wondering what's wrong, what you should do. Lots of questions come up.
Exactly. So, today we wanted to look into this using some great information we found from Omega Pediatrics.
Omega, yes, they provide pediatric care.
Right. And our goal here is really to, bring some clarity. What do parents need to know about diagnosing these infections, treating them, and importantly, when to seek that extra help?
Sounds good. Let's start with the basics. What exactly is an ear infection technically? Otitis media, right?
Yeah, otitis media, that's the medical term. It's basically an inflammation of the middle ear, the space behind the eardrum.
Okay, middle ear. Got it. And how does a doctor actually know it's that and not something else? Are there specific signs they look for?
There are. According to the info from Omega Pediatrics, the American Academy of Pediatrics, the AAP, has some clear guidelines.
Okay.
They say a diagnosis needs either a bulging eardrum, it looks like it's pushing outwards.
Right, under pressure.
Exactly. Or if there's new fluid draining from the ear, but only if the child doesn't have an outer ear infection, which is sometimes called swimmer's ear, or otitis externa.
Okay. So it has to be coming from behind the eardrum,
Pretty
essentially.
much. And there's a timing element too.
Right. It can't be something that's been going on for weeks necessarily.
Correct. The ear pain usually needs to have started quite recently, typically within the last 48 hours or so.
Okay.
And Omega Pediatrics really stresses this. You can't reliably diagnose it without solid evidence of that fluid buildup in the middle ear. Just seeing a red eardrum isn't enough.
That's a really important point because
Yeah.
a kid could have a red eardrum just from crying hard or maybe from a fever, right?
Exactly. So that bulging or the fluid drainage is key.
Okay, so knowing that, what symptoms should make a parent think, maybe this is an ear infection?
Well, the classic ones are obvious ear pain. And older kids, they'll tell you.
Or point to their ear.
Right, or tugging at the ear in babies. Then there's fever, and often just excessive crying or irritability, especially in the little ones who can't explain what hurts.
Makes sense. And does the severity matter? Like a really high fever?
Yes, Omega Pediatrics points out that if you have a higher fever, say over 102.2 Fahrenheit or 39 Celsius, along with significant pain, that combination makes it more likely that treatment, usually antibiotics, will be needed.
Okay, that's helpful. What about if both ears seem affected?
That's another clue. The information suggests that if both ears are involved, it's more likely to be otitis media requiring treatment, even if the pain seems a bit milder.
Interesting.
This is particularly true for kids between about 6 months and 2 years old.
Right, that age group seems quite prone to them.
They really do. And something many parents probably recognize. The pain seems worse at certain times. Oh, yes. The nighttime misery.
Exactly.
Yeah.
Omega Pediatrics mentions that increased pain and crying, especially at night, is really common in toddlers and preschoolers.
Probably has to do with lying down, changing the pressure in the ear.
That's the thinking, yeah.
hmm
It makes it feel worse.
Now, often before even getting to the doctor, parents want to do something for the pain. Is it okay to give pain relief?
Oh, definitely. Omega Pediatrics says it's perfectly fine, even recommended, to give appropriate doses of acetaminophen, like Tylenol or ibuprofen like Motrin or Advil, if the child is old enough.
Right. Got to manage that discomfort while you figure out the next steps.
Exactly. It helps everyone cope a bit better.
So you've given some pain relief, you decide to see the doctor. How do they decide what to do next? Is it always antibiotics?
Not always. This is where it gets a bit nuanced. Omega Pediatrics explains that sometimes, particularly for kids over 2 years old who have milder pain in just one ear,
Okay.
they might actually suggest an observation period. Maybe wait a day or two to see if it clears up on its own.
The watchful waiting approach. Right. But it's not a decision made lightly. It should be a joint decision between the doctor and the parents.
Makes sense. What do you need to consider if you do choose observation?
Well, Omega Pediatrics highlights you need to be able to reliably monitor your child's temperature, make sure the pain isn't getting worse, and crucially, have easy access to follow-up care and a pharmacy if things don't improve or antibiotics become necessary later.
Right, you need a plan B ready to go.
Definitely. But having said that, they also make it clear that in many, many cases, antibiotics are the main treatment, alongside that pain relief we talked about.
Okay. So when antibiotics are the way to go, is there a standard first choice?
Yes, according to the AAP guidelines that Omega Pediatrics follows, the first-line antibiotic is usually amoxicillin.
Okay, amoxicillin, that's a common one.
It is. That's assuming there aren't other issues, like a concurrent eye infection with pus purulent conjunctivitis, or, of course, if the child has a known allergy to penicillin.
Right, got to rule those out. And how long does treatment typically last?
It's usually a 10-day course, and it's typically a high dose, given orally.
10 days, okay? And what should parents expect? How quickly should they see improvement?
Omega Pediatrics says you should generally expect to see some positive change, less pain, fever coming down within about 48 to 72 hours of starting the antibiotics.
2 to 3 days. That's a reasonable time frame?
Yeah. If you don't see that improvement by then.
Then you need to call back.
Exactly. That's a signal to get back in touch with the doctor. A reevaluation is needed. They might need to try a different antibiotic, or perhaps even reconsider if the diagnosis was spot on or if something else is going on.
Okay, good to know. Now, for some unfortunate families, ear infections aren't just a one-off thing. They keep coming back.
Yes. Recurrent ear infections. That's tough.
So when does the conversation shift towards maybe needing something more, like ear tubes?
Right. Tympanostomy tubes or ear tubes. Omega Pediatrics mentions they get asked about these a lot. They're tiny little tubes that are surgically placed into the eardrums.
What's the purpose of those?
They help ventilate the middle ear and prevent fluid from building up, which is often the root cause of those recurrent infections.
Okay. Is there a specific number of infections that triggers considering tubes?
There are general guidelines. Omega Pediatrics outlines the typical criteria. Usually it's about 3 separate ear infection episodes within a 6-month period.
Okay.
Or maybe 4 episodes within the last year, as long as at least one of those happened in the most recent 6 months.
So it's quite specific. 3 in 6 months or 4 in a year with one recent one.
Pretty much. It gives a benchmark for when it's time to seriously discuss it.
And who makes that decision? Is it the pediatrician?
The pediatrician is usually the first point of contact, but Omega Pediatrics notes that children who might be candidates for tubes are typically referred to a specialist, a pediatric ear, nose, and throat surgeon, or ENT.
Right, the surgeons who actually do the procedure.
Exactly. They do the full evaluation. Because even though putting tubes in is a relatively common and simple procedure, it's still surgery, and there can be complications. So they're generally only recommended when those frequency criteria are really clearly met.
That makes sense. You want to be sure the benefit outweighs any potential risk.
Absolutely.
Now, you mentioned Omega Pediatrics. It sounds like they focus on being accessible for parents dealing with these kinds of sudden illnesses.
You really seem to. They're based in Roswell and Alpharetta, Georgia, serving that North Fulton area. And they seem to get that kids don't just get sick between 9 and 5.
No, they definitely don't. Usually it's 5:01 p.m. on a Friday.
Isn't that the truth? So Omega offers extended walk-in hours on weekdays until 9 p.m., which is huge.
Wow, until 9 p.m. for walk-ins. That's really helpful.
Yeah. And for their established patients, they also offer telemedicine options like e-visits for certain conditions. It just makes getting care a bit easier.
That accessibility, especially after typical work hours, can make such a difference when you're worried about your child.
Totally. They also mentioned offering after-hours immunizations, too, which is another plus for busy families trying to stay on schedule.
Good to know. So, wrapping things up, what are the key takeaways for parents listening today about ear infections?
I think the main things are understand what otitis media is, that middle ear inflammation.
Yeah.
Know the key signs doctors look for, like the bulging eardrum or fluid, and that recent onset of pain.
Right. And recognize the common symptoms in your child, the pain, fever, fussiness.
Yes. And remember that observation might be an option sometimes, especially for older kids with mild one-sided infections, but it's a joint decision.
And that antibiotics, often amoxicillin for 10 days, are frequently needed and should lead to improvement within 2 to 3 days.
Exactly. And finally, if infections keep happening frequently, meeting those specific criteria, then ear tubes might become part of the conversation with your doctor and an ENT specialist.
That covers a lot. And if people want to learn more or need pediatric care in that Georgia area you mentioned?
Yeah, for more detailed information or to find out about their services, the best place to go is their website, omegapediatrics.com.
Omegapediatrics.com. Got it.
And of course, if you found this discussion helpful today, please do give this video a like.
Yes, and subscribing to the channel means you won't miss out on future discussions.
And definitely share this video with other parents, friends, family, anyone who might find this information useful. Ear infections are just so common.
They really are. And remember, as a parent, Trust your instincts. If you're concerned about your child's health, don't hesitate to reach out to your pediatrician and ask questions. Being informed is great, but professional advice is key.
Couldn't agree more. Well, thanks for joining us for this discussion.
Thank you.